This week, people 65 years and older began getting vaccinated after Governor DeSantis strayed from the CDC's vaccine guidelines. The move means that the limited supplies of vaccines will be used up quickly, leaving younger people with serious underlying medical conditions having to wait a lot longer for their shot.
That's right. And CBS 12 News reporter Danielle Walsh, she joins us live now with what we know about when and how these at-risk adults might get their turn.
Lily and Jim, the timeline is still very unclear, but infectious disease experts hope that people with conditions like asthma and diabetes will be among the next to get the COVID-19 vaccine. They say it doesn't make sense to keep them waiting behind otherwise healthy seniors.
It's the first time I ever wanted to be older.
If Barry Silver were just 1 year older, he'd be eligible to get the COVID-19 vaccine now. But this 64-year-old has to wait, even though he has stage 4 cancer.
One, we don't have access to it. And two, we don't even know when we will get access or what's going to happen. Yeah. So it's doubly frustrating.
Florida prioritized long-term care residents and frontline healthcare workers for the first doses of the vaccine, and just this week started inoculating residents 65 and older.
I wish what they would have done is 65 and older and these individuals as well.
Infectious disease specialist Dr. Leslie Diaz thinks younger people with serious underlying illnesses should be next in line. She says they're at just as high of a risk from the virus as someone older.
I think a 50-year-old with Crohn's disease who is on a immune modulator is just as important as a 65-year-old that doesn't have any comorbid illnesses. I think they're even, I would tell you, more important.
While the Department of Health hotline and email address are only scheduling vaccine appointments for people 65 and older, CBS 12 News found there is one way someone younger with underlying conditions can get the shots. According to the state document obtained by CBS 12 News, local hospitals can administer the vaccine to anyone they deem, quote, extremely vulnerable. But hospital vaccine supplies are limited and local appointments are booked.
We've called so many different phone numbers and they all disconnect. I've called almost every hospital in South Florida.
Stacey Holcroft is 40 years old and has a compromised immune system. She's prepared to wait behind healthy seniors, but wants to know there's a clear plan for younger people at high risk.
Frustrating, upsetting, feel like our system's failing us. Just everyone's out to fend for themselves. You know, the only info I've gotten is info that
I asked Dr. Diaz when she thinks these at-risk patients will get access to the vaccine. She says she hopes in the next 3 to 4 weeks. Reporting live in West Palm Beach, Danielle Waugh, CBS 12 News.